and I'm pleased to welcome you to the second meeting of the Sub-Working Group of the Global Coalition on Synthetic Drugs, Sub-Working Group 3.3. Beginning this month of November through February, we will be looking at specific initiatives available to us through international organization partners. We will also explore new activities or policies that we can initiate. In January and February, we'll have the full menu of activities available for review, and we will invite you to express your interest to the international organizations managing the respective initiatives. Other administrative announcements, please update your screen name so it lists your name, your organization, and your country. Thank you also for your feedback regarding the number of calendar invites. We recognize that we have been sending many calendar invites for participants hour on the hour. So for future meetings, we are going to send a single calendar invite for the 3-hour block of meetings for this Sub-Working Group 3, but we'll still send both East and West sessions. And we're also seeking to increase coalition participation to include stakeholders from other ministries. So please continue to share the registration links with others in your government. I also want to note that the coalition website has launched, and you can find the address at globalcoalition.us. I'm going to ask Bill from the INL team to post it in the chat. And with that, I'm going to share here the agenda. We've got a robust number of presentations and we're slightly behind. So I'm going to turn it over to our two co-chairs, Mr. Daulet Baypiasov and Mr. Aris Mangera. They are from the Republics of Kazakhstan and Philippines, respectively. So over to them for today's presentations. Thank you so much.
Спасибо, Брайан. Здравствуйте все участники.
Thank you, Brown. Hello to all participants of our current meeting. It's our second meeting of our subgroup. We have 4 very interesting presentations today. I hope that it will be a very interesting discussion to follow them. There are a lot of new information, useful information will be delivered. With regards to speakers, every speaker has 4 speeches, 7 minutes each. Then there will be commentaries, and after that we will open the floor for discussion. And we plan to spend 15 minutes because we're very limited on time. So please follow this schedule. First, a presentation will be Anja Busse. This is a program officer from rehabilitation and prophylactics of drugs and the crime from United Nations. She will talk about international standards, alternatives, and issues of human rights. Please, Anna, the floor is yours. I have a list of 4
Thank
presentations.
you so much for the opportunity to present to you our initiative on treatment and care of drug use disorders for people in contact with the criminal justice system, with a focus on alternatives to conviction or punishment. As you know, the best response to treatment of drug use disorders is evidence-based treatment, such as what we have laid out in the UNODC WHO International Standards for Treatment of Drug Use Disorders. It has proven not only to reduce drug use and improve the quality of life and health of people with drug use disorders, but also to reduce associated crime, while it costs less than doing nothing, than incarceration, than probation, and it also kind of produces additional positive outcomes for the entire community. Nevertheless, many people with drug use disorders are in contact with the criminal justice system, including only for offenses related to personal use of drugs. So here you can see, based on UNODC estimates, that even at the conviction level of the criminal justice continuum, more than half of people are in contact with criminal justice system for drug possession for personal use offenses. We do know that drug use does not stop in prison. On the contrary, estimates say that there is 4 times as much drug use in prison than in the general community, and there is very limited access to treatment of drug use disorders in the criminal justice system. So it's really a prerogative to keep people who are in contact with the criminal justice system for personal use offenses in the community and offer the best treatment we have. And in that context, also keep in mind the global prison overcrowding crisis, to which we could contribute by, again, keeping people that do not require incarceration, people with drug use disorders, personal use of drugs in the community, and support them there instead of sending them to the prison system. But nevertheless, we see that there are way too many people, not only in prisons, but also in so-called compulsory treatment or detention centers, or in clandestine centers that do not have a license, that are often associated with human rights abuses, or people find themselves without any access to treatment of drug use disorders, as a global gap for treatment of drug use disorder prevails, and at best 1 in 5 people with drug use disorders has access to treatment. Just to say that compulsory treatment as such is ineffective due to the biopsychosocial nature of drug use disorders, and that human rights abuses and degrading practices have no place in treatment of drug use disorders. The use of compulsory drug detention and rehabilitation centers is a custodial measure, and such does not qualify as a non-custodial alternative to conviction or punishment. UNODC and partners have called frequently for the closure of compulsory drug treatment or detention centers. So the good news is that there are multiple international policy agreements that support treatment as an alternative to conviction or punishments, especially in cases of personal use and other minor offenses committed by people with drug use disorder. So for example, in the International Drug Control Conventions, the parties to the conventions, the countries, have taken a commitment to provide a continuum of care, including prevention, treatment, rehabilitation, aftercare for people in need. And they have agreed that these measures can be offered, including as a complete alternative to conviction or punishment in cases related to personal use and other offenses of a minor nature. Please also take into account the larger kind of international legal framework, where the United Nations standard minimum rules for non-custodial measures, or the Tokyo rules, really call on us to consider prison really always as a measure of last resort, and the Bangkok rules that have specified this further for women in contact with the criminal justice system. Also, we need to take into account international human rights obligations. I've just, as an example here, mentioned the right to health, but there are also additional rights, like the right to be free from degrading treatment or medical experimentation or other things. Both the Commission on Narcotic Drugs and the Commission on Crime Prevention and Criminal Justice, UNODC steering bodies, have taken this up several times and put it into more detailed resolutions, like CND Resolution 58.5 on supporting the collaboration of public health and justice authorities in pursuing alternative measures to conviction or punishment for appropriate drug-related offenses of a minor nature, and have called or invited UNODC in consultation with member states to provide guidelines and technical tools to enhance this justice health collaboration, and have also invited member states in collaboration with UNODC and relevant other entities to work on technical assistance and training to improve health and justice collaboration and the implementation of alternative measures to conviction or punishment for appropriate drug-related offenses of a minor nature. In 2017, already UNODC and WHO have launched a respective initiative, Health for Justice, Justice for Health. And we have developed a range of technical guidance documents, including on how to best do treatment of drug use disorders and how to do it as an alternative to conviction or punishment, at what stage and how to refer people out from the justice system to the criminal justice system. We have mapped the current situation with regard to alternatives to conviction or punishment. We have implemented training materials, and all of this is available for you, and we are continuing to provide further guidance. As you can see here, as I'm highlighting our future plans, we want to do a continued mapping of diversion opportunities that exist in the world through different ways. We will include the work on treatment as an alternative in the dissemination package of the international standards for treatment of drug use disorders. We are continuing, and we need your support and interest to continue providing technical assistance at country level and demonstrate that treatment as an alternative is also feasible, and we can demonstrate the outcomes in low middle income country settings. We are also working on the development of implementation principles for treatment as an alternative based on extensive expert consultations and to make implementation at country level more easy and more manualized. And please also note that we are finalizing an online training course on treatment as an alternative. And we are considering to develop kind of a quality assurance package for treatment as an alternative for countries that have already started this work. And obviously, we're linking with different partners and networks in the different regions, some of which you might hear today about as well. Please also note that in this overall initiative on Health for Justice and Justice for Health, we are also considering more and more the needs of people that might have to go to prison and have a drug use disorder, and how we can best offer and support evidence-based treatment of drug use disorders in prison settings and upon release from prison. Please join this initiative. Please also kind of help us make it more adjusted to the needs of countries that are more affected by synthetic drugs as well. And we're looking forward to work with you and hear from you. Thank you so much.
Большое спасибо, Аня, за доклад.
Thank you so much, Anja, for your presentation. It was very interesting. Of course, we understand that one of the key points is the availability of conventions. By joining those, any country, and many countries have already used that opportunity, but many countries can then use different alternatives to incarceration without violating any human rights. We understand that incarceration is not always optimal for recovery. Prison is not really a place where you treat addiction. Unfortunately, because of time difference, Anja is not here on the call, but Giovanna is here. She's the head of the Prevention, Treatment, and Rehabilitation section. And after all four of the presentations, when we move on to the discussion, she will be able to answer your questions. And now I would like to give the floor to Michele Worobiec, international expert and leader of the International Consortium for Alternatives to Incarceration. We will hear her presentation on alternatives to incarceration framework within the entire institutional process. Please.
All right. During our limited period of time, we had a couple of goals to share with you. One is to explore how ATI country development and support can take place across the entire justice continuum, and also introduce you to the International Consortium for Alternatives to Incarceration. So let me get right into the content. If my computer cooperates, there we go. Building upon what Anja just explained about the effectiveness of treatment and care, I want you to keep in mind what the structure of that looks like. So it's a multi-system collaboration between the justice system, the treatment system, and social services. Here, with the justice system, we want to make sure that we quickly identify through validated screening tools that individuals coming into our system are actually in need of treatment and care. Once we identify individuals that might need that care, we need to quickly engage with the treatment system for a more thorough evaluation and to assess the levels of care that are required. And so justice and treatment will work together to make sure that justice provides any needed supervision or accountability. Treatment provides the clinical care and services. And of course, we realize that it's critical to make sure that we build the protective factors of those individuals and resolve any of the social determinants of health where they may have instabilities, and also bolster their thinking skills, their life skills, and other things that may place them at a higher risk to going back into the justice system. All of this is tightly wrapped around through a comprehensive multi-sectoral case care management system. So generally, this is a cooperation between the systems, and we can see it happen in all parts of the justice continuum. So I know this is small, and you'll have a copy of these slides later, but we're going to have a basic overview here. So at the pre-arrest stage, we have an opportunity for law enforcement and other first responders who are called to the community emergency to determine whether or not this is really a legal emergency requiring court involvement, or if it's more of a health crisis that requires engagement in treatment and care. And in the United States—
My apologies, Michele, my apologies. Interpreters are asking you to slow down, please. Thank you.
Okay, no problem. So at the pre-arrest stage, we have an opportunity for law enforcement and other first responders to identify the crisis as a health condition, a need for SUD treatment and co-occurring disorder treatment, and maybe also to bolster some instabilities with housing or food insecurities and the like. Referring directly to the services at this level will avoid any of the negative consequences of arrest and further involvement in our justice system. Going further into the system, if there is an arrest made or a referral to a court proceeding, then we have an opportunity both at the inquisitorial phase, either by prosecutors or magistrates, or further in the adjudication to consider whether we need to have the full justice system involved, or again, whether there is an opportunity for a structured intervention with treatment and care. At the prosecutorial level, generally those are cases where we don't see a significant risk for recidivism. And when it gets deeper into the court system with the judges and magistrates, that might be more appropriate for a case where we realize that there could be a likelihood of someone returning to the justice system and requiring extra care, or that the nature of the behavior that brought them into the justice system requires tighter oversight and structure. And then finally, even if someone is convicted of a crime, we have an opportunity after that conviction to decline to put someone in jail or prison, to suspend those sentences and to allow treatment and care as a part of community supervision. Or if someone is serving time in a jail or prison, commonly people will ask, what about murder? Well, if there's murder, there's likely going to be some time in the correction system. But upon release, we need to realize that those individuals require the treatment of their substance use disorder and all of the stabilities. So we need pre-release treatment and services and planning. We need the transition planning, and then we need the services to continue as they re-enter and try to reintegrate into the community. ICATI is a new organization. We will be hopefully launching at the CND this coming year in March. And we were formed to extend the conversations that we're having today, to provide resources, to create networks, and to support ATI development for countries, for communities, for individuals. We're really able to be kind of the first stop for ATI. And so you can see here 3 areas that we'll be working on. One is supporting the exploration and development of ATI for countries and communities. Also making sure that we can link you to all the wonderful resources. You've already heard from sources that are available from UNODC and other colleagues, and we will be adding to that the field of information and evidence that is available to guide your efforts. We can extend the learning, so having robust webinar series, informational materials that accompany those, developing specialized ATI curricula to build upon our current policy leader course and our case care management course, and also working to develop a global atlas of ATI initiatives along with quality indicators. And finally, a network. So you're not going to be doing this alone. We will have an opportunity to bring countries and professionals and systems together to give you the ongoing connection with colleagues and support. Finally, I wanted to review what we have seen as a progression of ATI development in countries. It starts off initially with perhaps where many of you are right now. You have interest and you're interested in exploring the issue. From that, when there is an interest to develop ATI, there's a period of systems preparation to make sure that your justice system, your treatment system, and your NGOs in the community are ready to launch this kind of a system and are starting to work together. Then in phase 3, it typically involves the ATI policy leader course, technical assistance, support for implementation, and data collection. At that point, often countries are partnering with our international organizations like UNODC, or OAS CCAD, and Colombo Plan. And then through phase 4, we look at ATI expansion. So it's not just one program at one part of the justice system in one part of the country that will really provide the robust interventions we need. So ATI expansion can look at that geographic expansion as well as expansion across the intercepts. I'm sure my time is coming to a close. So the last thing I would like for you to do is to please engage with us so that we can continue the conversation. You are the first group to see the new ICATI email, so you can reach me at michele.worobiec@icati.org. I was not able to get a MailChimp link to put into the chat box, but we will quickly have ways for you to sign up for information. And I welcome the opportunity to continue the conversation. Thank you.
Спасибо, Мишель. Действительно, очень нужная.
Thank you, Michele. Very useful, very important information that we've just heard. I think many countries, many participants of today's working group will use the opportunity offered. And I'd like to say that in the chat, there is a link that will allow you to join the International Consortium for Alternatives to Incarceration. And I would like to wish you success, because what you do is something that's really needed, because within the entire continuum, pre-arrest, during investigation, any person who finds themselves in this situation should be able to get those services, and they need to be comprehensive. So it's very important. Thank you, Michele. And the next presenter is Antonio Lomba, Head of Institutional Strengthening, Anti-Drug Commission. And please, Antonio, the floor is yours.
Good morning, good afternoon, good evening, depending on where you are. My name is Antonio Lomba. I'm the Chief of Institutional Strengthening here at CICAT, the Inter-American Drug Abuse Control Commission of the Organization of American States. Let me take just a few seconds before we start to tell you something about CICAT, so you know where I'm coming from. Well, the Inter-American Drug Abuse Control Commission, as you have on screen right now, is the consultative and advisory body of the Organization of American States on the issue of drugs. And it serves as a forum for all the OAS member states, for all the countries in this side of the hemisphere, to discuss and find solutions for the drug problem. So I work for the Executive Secretary. We have 5 units at the Inter-American Drug Abuse Control Commission, 5 units: the supply, demand reduction, institutional strengthening, the MEM, which is a mechanism for evaluation, and also the Observatory on Drugs, the OID. Just briefly about the main programs that we handle here at the Institutional Strengthening Unit. One is pretty much we dedicate a lot of time in supporting member states in the development of national drug policies, strategies, and plan of action. Among them, you incorporate, alternatives to incarceration and many other things. The other main pillar is to support member states in developing or exploring, developing or implementing alternatives to incarceration. There are some examples of the things that we do on the screen. And the third one is working on alternative development. Let me just go into, and I really was great that Michele presented prior to me, and also Anja Busse from UNODC. As Michele described the major steps towards the implementation of alternatives to incarceration, she describes, a big line of them. I'm going to focus on 4 particular ones, but primarily I'm going to dedicate most of my time on the first one, on the partnership development. Countries, sometimes even individuals, individual courts or individuals in different stages of the judicial system have been implementing alternatives to incarceration of many kinds for years. Current legislation in many countries allows to divert or to send to a health facility treatment individuals with a health-related problem. mental health in many cases, but also those who suffer from a substance abuse problem and are in conflict with the law. Most of them minor or non-violent offenses. And it's due to their addiction. We have encountered, which is interesting, as we've been supporting member states in exploring or implementing alternatives to incarceration, we've been encountering that alternatives to incarceration have been implemented in countries when even the country itself doesn't know that they're implemented sometimes. And it's just, you wonder why, how is that possible? Many times, judges, many actors from law enforcement or the judicial system are tired of the constant revolving door. People who come, go to prison, get out, and come back again before the court, the same person, with the same face, the same problem, only that the problem gets bigger and bigger. And with the time, it gets too complicated. These judges and other actors, social workers, court liaisons, probation officers, champions, if I may call them that way, they find ways to resolve conflicts at the court or the community levels. I am sure you've heard about problem-solving courts or solution-finding courts, as the Chief Justice of Trinidad and Tobago used to call them. I like that option. Many different options, many courts and ways to resolve conflicts. But in many cases, and that's what happens, is not enough. That is very locally based. Many of those experiences are very locally based. And sometimes a judge or a chief justice or attorney general or a legislator or even civil society member or even a mayor decides that decides to take a bigger step and ask for help. And that's just for those efforts that do not remain local and have the chance to expand and consolidate. And this is when we, international organizations, regional or international institutions, experts, all come on board. Some countries are really implementing alternatives to incarceration models while others are in developing stages. In some cases, they just need a little support. In some other cases, the need is more basic. It goes from the very scratch of the process. From our experience, after 15 years supporting countries develop, implement, and evaluate alternatives to incarceration, here are some basic factors that we look forward for when we are developing or exploring alternatives to incarceration. First and foremost, leadership, authority. Who is running the circles? Who is going to be running this? You need an institution to be leading the process. As much as this is a multi-sectoral action, you need one institution to lead. Understanding, the second point, understanding of what substance abuse is and what treatment involves. As Anja from UNODC described earlier, there are many elements in the treatment process. And the importance of social integration to stop the revolving door. At the end of the day, if you don't find a job or education or many other, you have those resources in place, whatever the person leaves the judicial system. So that person is a person that could contribute to the society, who could earn money, who could have education. Unless you have that social integration element, work with the families, with the community, this is very difficult. The revolving door is difficult to be stopped. Third, openness and accountability, creating baselines for future evaluation. You need to set that so later on in 4 years or 3-4 years, you can compare yourself, make adjustments, and be able to make progress and learn from failures and from successes. The fourth, a team approach, interest in promoting interagency cooperation and coordination. As much as I said in the beginning, you need one institution to lead. This is not possible to be done without a team. You need all the sectors involved. In stages 2 and 3 that are on the screen, they are absolutely crucial. The training, the action planning, all of that is crucial. This requires a precise identification of needs. So training can be tailor-made, evaluate high risk and high need, and the profile of individuals that are going to be entering this alternatives to incarceration. And the countries and institutions, they need to have the capacity to collect and analyze information, as I said before, to make adjustments along the way. They need to have a capacity also to analyze if it's in the short term or long term, there is any need to have regulation to create a legal landscape. In many cases, the landscape is there. The legal landscape exists. In many cases, countries decide to go with a policy paper and start with that, and then 3 or 4 years along the way, they start reading and reviewing legislation. On this slide, you will see, at least from this side of the Atlantic, a map with 18 countries right now that are exploring, implementing, or evaluating alternatives to incarceration of many different kinds. You may find restorative justice programs, therapeutic justice programs, community courts, community justice programs, reentry models, drug treatment courts, or drug courts, wellness courts, and mental health courts for adults and juveniles. And we at the CICAR, at the Inter-American Drug Abuse Control Commission, going from 5 countries in 2008 to now that you have in 2023, 18 countries exploring, we've done that through different programs and actions. You have some examples there on the screen, some projects, some of them I mentioned them already, like just exploring alternatives to incarceration with all these different modalities that I described. Monitor evaluation is a basic, is a need. You gotta have a monitor evaluation system when you start exploring alternatives to incarceration. Then we are also working in developing tools to allow the judicial system to have a better way of understanding eligibility criteria and apply that. Gender in the criminal justice system, many countries are right now evaluating how alternatives to incarceration impact gender and the other way around. And we are working on that intensively. Case care management, you will hear that a lot, is the social integration component, is that element at the end that you need to have in order to have a successful alternatives to incarceration. And then strengthening other actors in the community, like therapeutic justice, therapeutic community, and how civil society supports that from different angles. We have a lot of examples on that. And that's it from my end. I just want to end up just giving my contact information and email. If you need anything or just want to talk to us, please do so. Send us an email. We'll be happy to support. Thank you so much for your time. Appreciate it.
Спасибо, Антонио. Очень интересно.
Thank you, Antonio. Very interesting presentation. A lot of useful information. Your key word is partnership. It's indeed very important today. We understand that we have to do things collaboratively, especially when it comes to this process. So this idea and this comment was very important. Another idea is leadership, understanding what is the drug dependency, social integration, also an important factor, accountability and ability to monitor the processes, see how the integration is happening. It's very important. The 18 countries involved in this project and exploring those opportunities. I hope that this number will expand. So all the best. And the next presenter, I would like to invite Charlotte Colman, the Associate Professor, Drug Policy and Criminology, Kent University of Belgium. She's also a National Drug Coordinator, President of the General Drug Cell. We will listen to her valuable presentation, and we will understand her position on the drugs and how is it related to the justice system. So Charlotte, please, you are welcome to start your presentation.
Good day, everyone. I'm Charlotte Colman. I'm a professor of drug policy and criminology at Ghent University in Belgium, Europe. I have been collecting stories about people in recovery from addiction and desistance from offending for several years now. And from that research, we know that most people who get addicted and are offending, that they do recover and desist, although it might take some time. And people overcome addictions and offending by a combination of 3 factors. Personal factors like I'm getting older, so I want to change. Social factors like I met the woman of my dreams, so I want to change. Or then community factors. These are the resources offered by your community to be able to change. And it also became clear that for most people that I've talked to who have been involved in drug use, but also offending related to their drug use, that recovery comes first and that recovery leads to desistance, which means that for many people involved in the criminal justice system because of offenses related to drug use or addiction, that working on recovery might also lead to less recidivism. In my short talk today, I will not focus on the individual and social factors of recovery, but I will mainly focus on the community factors, because for me, what is equally important as willing to change is to be able to change and to be able to sustain your change. I had the chance to meet lots of wonderful people during my academic career, and one of them is Caroline Cooper. And Caroline, she studied how Native American tribes, how they deal with addiction and recovery. And for these tribes, the health of the community is only as strong as the health of its individual members, which means that when you get on the wrong track, that the community intervenes as a whole. And this is very different from what I have learned in working with my cities, my Belgian cities, because in Belgian cities we mostly tend to focus on what is wrong and could go wrong again in the future. So we mainly focus not on empowerment and agency and strength, but we mainly focus on relapse and recidivism. We all know that people who struggle with addiction, even those in recovery, they experience stigma and discrimination. And surveys, they have indicated that the majority of citizens, so people like you and I, that we agree that we should support recovery. But when we ask about how they feel about more personal interactions with people who use drugs or people in recovery, many had concerns. More than 40% do not want to live next door to someone who has been dependent on drug use. And most employers, they don't want to offer a job to a person in recovery, even if that person is fit for the job. And these kind of surveys, they present a NIMBY principle, the not in my backyard principle. They tell us that addiction could often be seen as an irreversible stain, that people with active addiction, but also those in recovery, that they might face the same discrimination, that employers and landlords, that they don't trust them, but that even their family, their loved ones, that they don't trust them anymore, which means for some people in recovery, no work, no house, no safety net. So the question is, how did we get there? And overall, it seems that we lack knowledge of recovery. From research, we know that people discriminate more often when they are not familiar with the topic. It means that you are more reluctant to and often afraid of something that you don't know about. And another reason could be our resources, a lack of resources or a different allocation of resources. Because mostly, in most cities, only the negative consequences of drug use and addiction are visible in our cities, like needles in the park, intoxicated people dwelling on the streets, and we mainly invest in making those negative consequences invisible, instead of making the good news, recovery, for example, to make that visible. And the question is, how could we change this? So quite easy, maybe by making the good news visible and to make recovery visible, to talk about it and to engage people. And David Best and I, he's also an expert in recovery and desistance, we have visited communities, we have listened to practitioners, to people in recovery, to people struggling with addictions, etc. And from that experience, we came up with the idea of an inclusive recovery city. And we made a step-by-step guidebook to help cities transform into inclusive recovery cities, especially focusing on those community factors leading to recovery. And today we have several cities across the globe who are transforming themselves into inclusive recovery cities. So to explain this very shortly, we use the city as our playground, and we bring all relevant stakeholders that had a thing to play in recovery by bringing them together in order to organize events and to promote knowledge regarding recovery and to spark engagement. So these are not ad hoc events, but organized events. And the main goal is to first make recovery visible, and second, create activities to spark knowledge, to create visibility regarding recovery. And the first step is that you install an inclusive cities council. And this is a core group. It consists of, for example, prevention workers, treatment workers, policymakers, city council members, academics, employers, citizens, and especially people in recovery. And this core group, they focus on two things in the beginning. So first of all, they make a mission statement. They make a definition of how they see and understand their inclusive recovery city. And based on that mission, they are going to develop activities with all relevant stakeholders. And we advise to organize activities every 6 months to keep people engaged and to spark that knowledge, to make it discussable and to celebrate recovery. Indeed, you heard it correctly. We are about celebrating recovery because we celebrate a lot of events in our lives, like births, graduations, marriages, and this involves ritual. And ritual, it fosters social bonding. It strengthens solidarity, it strengthens social cohesion, and brings people together. And celebrating recovery is beneficial for a person in recovery, but also for the whole society, because people in recovery are often called recovery champions. They are the living proof that recovery is feasible and possible to people still struggling with addiction, for example. So the point is to activate all these people who want to make a change and to translate the intention in structured actions and to bring everyone and everything together. And these actions could consist of very small things, low-key ones or more structural ones, and this basically depends on the resources that are available in your community. And one of the examples is, for example, Jobs, Rents and Houses in Blackpool. This is a social enterprise model, and in this project, people in recovery, they learn to build and renovate houses during an internship. And afterwards, these houses, they become available for sale or rent by people in recovery. Another example is a recovery game in Doncaster, but there are similar examples in other cities. And it started as a button-up project, and it is organized every year. These are fun-based sports activities with practitioners, people in recovery, the families, but also the community as a whole. And the latest edition, they had 1,000 attendees from England, Scotland, and Wales. But it could also be about the smaller things, like the words that we are using. Our words are very powerful, and it only requires a small effort to choose our words wisely, to choose that we show ability to help and to encourage rather than to hinder and hurt someone by our words that we are using. Because evidence demonstrates that if you are exposed to words like drug user, addict, offender, it increases stigma and discrimination, which could lead to people with addictions failing to find support and poor treatment outcomes. So, in a nutshell, if you want to find more information about inclusive recovery cities, we have a website. It's still in construction mode, but please feel free to visit it. And if you have any other question, you could email me and I will be happy to answer it. Thank you.